Today's podcast is brought to you by Isoway Sports, the sports range for athletes looking for supplements that are free from all artificial colours, flavours, sweeteners and added fructose. Intense physical training programs place significantly higher nutritional demands on sports people, and Isoway Sports are committed to providing pure nutritional ingredients that are truly complementary to a healthy, active lifestyle. You can visit isowaysports.com.au for more information. This is FX Medicine, and I'm Andrew Whitfield Cook. And with me on the line today, all the way from Queensland, is Dr Amie Steel, who is a naturopath of over 15 years' experience with a PhD in health services research. Now, she was looking at the role of naturopathy within maternity care in the Australian healthcare system, a very important thing to investigate. Amie's been involved in naturopathy in a variety of capacities, including clinical practice, industry, policy development and research and academic activities. Amie is currently the chair of ARONAH, supporting statutory registration of naturopathy in Australia. Welcome, Dr Amie Steel.
Thank you. Thank you, Andrew.
So, Amie, given your wide variety of activities within the naturopathy industry and profession, what would you say are the major challenges facing naturopathy in Australia at this point in time?
Well, there's a few different areas that I think are potentially causing problems for the development and advancement of naturopathic practice. One big area is this issue which I call co-option and appropriation. So this is where what naturopathy actually is being picked up by really anyone who wants to practice what is loosely defined as natural medicine. So naturopathy has had 100 years of practice in Australia and has core defined philosophies that underpin practice and the approach to practice. But what it has become in more recent years, particularly in the last 30 to 40 years, is an area where basically anyone who wants to practice anything within the vast field of natural medicine, irrelevant of whether they're following naturopathic philosophy or not, is calling themselves a naturopath, which is antithesis to the World Health Organization definition of naturopathy and the World Naturopathic Federation definition of naturopathy.
So there's good definitions out there of naturopathy with the World Health Organization? I didn't know this.
Absolutely. So the World Health Organization actually worked on a core document around naturopathic medicine. It had its own history, which was not, and it's not the strongest document because at the time we didn't have an international body. The World Naturopathic Federation has since formed, and they've just recently done a survey involving 18 different countries where naturopathy is practiced. Yep. And there's 95% consensus about the definition of naturopathy across those 18 countries. So that strength of across the globe of what naturopathy is outside of just Australia. And but unfortunately, the lack of definition within Australia, we don't have anyone who's clearly standing up and saying this is what naturopathy is. We don't have enough of that, particularly for those outside of the profession. So I often am asked by government representatives, we're not really sure what a naturopath is, so how do we know what they can do or who we should send to them or what we should do with them?
Yeah.
That lack of definition goes hand in hand with the co-option and the appropriation. And they're two areas that are causing major issues.
Yeah. So my understanding of it was that, you talk about it, naturopaths don't necessarily know what they are. My way of looking at it was that naturopaths don't know what they are not.
Well, potentially. I think that one of the problems actually is that natural medicine is the definition of that broader catch-all group of natural medicine is become more of defining themselves by what they are not, and less of a focus on defining themselves by what they are. Mm-hmm. And so what we've really focused on with ARONAH is developing a core definition of what naturopathy is, what it means to be a naturopath, what you need to be competent in to be able to be calling yourself a naturopath. And we haven't had that documentation and that clear detail to be able to hand over to other health professions and to government, and so that they are aware of. It's very hard to plot the role that we as a health profession have within a health system if we can't even tell people who we are and what we do.
Yeah.
It becomes incredibly difficult, and so there's never any way to put us anywhere and to understand how we could possibly work with other health professionals to do that.
Okay, so what needs to happen to overcome these challenges then?
Well, I guess the one thing that, because there's probably the third challenge as well, is we lack professional unity. And so we've got disagreement over standards across different associations, but ironically, if we can overcome those issues, we'll probably find that the associations have got more in common than they actually hold different in a lot of areas. So I think the solution really, there's going to be a lot of pieces that have to fit into the puzzle, but a key foundation is statutory registration. And it's not to say that statutory registration is a cure-all. It's certainly not intended to be so. There are a number of other issues that we face within our profession that we would also need to address, but it is a really good, strong start, as it will clear away a lot of the outside issues and allow us to address some remaining fundamental factors that'll be a part of that as well.
What does statutory registration mean, though, Amy?
Well, this is something that often causes a lot of confusion for practitioners, because what it actually means in Australia is that the title of naturopath is protected, and that only people who fulfil certain education and practice standards can use that title. And this is really quite important. And so, and in doing that, and once they are registered, then they are held accountable and held to certain standards upon which they may practice. Now, it's also important to realise that these standards, they shouldn't be confused with protocols for treatment. This is not to say that you'll be told if some patient comes in with depression, you must prescribe them St. John's wort and you must do this and you must do that. It's not about that. There are more standards that are defined by the profession, and they're more about how to approach care, that you'll provide individualised care that is safe and considerate of the patient's, place in life and all of those kinds of things. They're the sort of standards that we're talking about. It's more defining and describing exactly how a naturopath approaches treatment rather than what they specifically do for a patient.
What does it not mean, though?
Well, from that point of view, I guess it doesn't mean it defines scope, as I said. But also there's a lot of other things that statutory registration doesn't mean. It doesn't necessarily mean that it will give us guaranteed access to Medicare, and that in itself could be a double-edged sword. It would be great to be able to provide public funded care to lower income communities. But the flip side, of course, is then you're tied into a lot of the restrictions that GPs and people like that act in under. So that's not to say that there will be government-funded work for naturopaths, assuming there's registration. It also doesn't necessarily mean that you're going to start getting higher referral rates from general practitioners or other health professionals to naturopaths. Having said that, the other three CAM professions, osteopathy, chiropractic, and PCM, in Australia that are registered, since registration has come in place, their referral rates have gone up. And I'd say what's happening there is that whilst there is going to be always be a group of stalwart doctors who will insist that they would never refer to a naturopath, there are going to be a group in the middle who probably are a bit ambivalent and don't really mind if their patient goes to a naturopath, but are uncertain about the ability to ensure safety and accountability for good care should that happen. And if they refer to an unregistered practitioner, they can actually, and something goes wrong, they can be made liable for providing inappropriate care by giving that referral. So by having a registration body in place looking after naturopaths, and that sort of release the onus from them to make sure that the practitioner is safe to begin with. And so from that point of view, it is possible there's higher referrals, but it's not guaranteed. It also means that it may not mean that there's increased support from the medical community necessarily, but as I said, it may actually provide that ability for the ambivalent practitioners who don't necessarily support naturopathy but also aren't particularly against it to be able to work with naturopaths more appropriately and effectively.
So to me, it's like practitioners that do enjoy that protection of registration can know that naturopaths are both safe and accountable for their actions.
That's correct, absolutely. And it's also true for the case of for naturopaths. It means that the majority of incidents, the vast majority, in fact, of incidents that have resulted in naturopaths, and I use that term, carefully.
In the current landscape,
in the current situation, causing damage to the public in some way, affecting ill harm, those practitioners have, without a doubt, almost every incident has been related to a practitioner who would not have been accepted into a registration program, whether they had a previous criminal background, whether they weren't appropriately qualified, whether they'd already had an incident in the past that would have had them under restricted practice, all those sorts of things. If we had registration, then that would be less of a problem. And so one of the issues that we're having is some of the bad reputation that naturopaths have in the community. It's not the naturopaths that are doing it. It's the people who aren't naturopaths.
But are calling themselves
using the
naturopaths.
Title of naturopath.
That's right. And to me, this is the crux of the matter is there seems to be this real argument as do we want registration or not? And coming from a nursing background, my stance is, why would you not want registration when you want protection of your title? It's the only way, because right now, the people who are actually causing damage to your name are the people that aren't like, quote unquote, you. But they're allowed to call yourself you. So it's kind of like an imposter sort of thing. How do you stop an imposter? Well, you take out you make them identifiable.
That's right. And so what we have at the moment, because as a brand, naturopath is quite a strong brand in Australia compared to the United Kingdom, for example, where people know of a herbalist or a homeopath, but naturopath's not as well known as a profession. And so, but people have heard of naturopaths in Australia, and so you have a lot of people who trade on that brand, who have done a couple of courses here and there, picked up a few things, but haven't had the foundational core training that is expected of a naturopath. And they are, but they're able to hang out a shingle, call themselves a naturopath, and the public are not able to tell the difference.
Yes.
And so they'll come in with high risk cases, with vulnerable populations, complex situations, polypharmacy conditions, and the practitioners who are calling themselves a naturopath but don't have the training to provide high-level naturopathic care, making mistakes in amongst that and putting the public at risk. And as a result, putting the profession at risk.
Yeah, that's right. So, all right, so where are we up to in the landscape of Australia? Because I thought this has been going on for decades.
Well, it has been. Well, one of the history behind it is kind of quite frustrating. We actually had registration in the Northern Territory about 30 years ago, and then that got pulled. And it's really frustrating and partly because there wasn't enough naturopaths to justify it, but in the Northern Territory, and that's really frustrating. And then what happened is when the Victorian government, once they'd implemented the Chinese medicine board in Victoria, they then said, okay, we also need to look at naturopaths. So they did a review against a criteria that had been established about 20 years ago. And this particular criteria was set by the government to say, if we're going to have registration, then you need to justify it against a set criteria. And this set criteria has actually been used for this report that was done in Victoria. And they evaluated naturopathy as a profession to identify whether or not there was sufficient risk to the public for people to provide naturopathic care without being appropriately qualified and registered.
Yep. And
the outcome of this report was yes, that was the case. Now, the next step for the Victorian government would have been to set up something similar to the Chinese medicine registration board that they had for naturopathy and herbal medicine. But unfortunately, the timing was just not quite right for us, and because the national registration scheme started to get set up. And so the Victorian government said, you know what, we're not going to set up our own registration board because it's all being rolled into this national registration scheme. So we're going to take this report and give it to the Council of Australian Governments, where all the state governments come together, and let them roll it up into the national registration scheme. And it's been sitting there ever since.
So we've had no champion?
So we don't have a champion, and that's what we need. And it's quite frustrating. I mean, if Northern Territory had retained its registration for naturopaths, we would have been wrapped up in the same way that the Chinese medicine profession was. They only had one state that they were registered in, but we would have been able to be pulled in. And so when they set up the national registration scheme, there was 3 steps. The first was any profession that had national registration were assimilated in. And the second was any profession that had at least one state was pulled in. And the third is to develop the pathway for new professions that were as yet unregistered that needed to be. And we're still there. So part of the reason we haven't gone anywhere is just bureaucracy. The Health Practitioner Regulation Agency hasn't actually developed these pathways. So, but the flip side of that is that you can, if you've got a strong enough champion, as you mentioned, you can overcome that bureaucracy. So paramedics had not been assessed against the criteria in the way that naturopaths had. They hadn't been sitting on the table for 10 years the way that naturopaths had. But one of the state health ministers discovered that paramedics were not registered and identified that that was not okay. And so they pushed for it, and they've been pushed through the system themselves. So they've actually been bumped up ahead of naturopathic registration, and we've been told by certain government contacts that whilst naturopaths are still sitting on the table, not dismissed, not being told we're not being registered, but just not really being considered one way or the other. Yeah. They've acknowledged that paramedics will be going through as soon as they can.
So to me, this is where ARONAH sits perfectly, because in my mind, you have your various associations, but you need a lobbying group, and this is where ARONAH is different. So I'm going to ask you, what's ARONAH?
Well, ARONAH is the Australian Register of Naturopaths and Herbalists, and in part it was established in response to this gap, the fact that registration has been acknowledged as being needed and wasn't being enacted by the government. But what we've instead, it's independent and voluntary. It is not government statutory registration, and the only people who would join ARONAH practitioners are voluntary members. But what people often miss, and you've picked up on very well, is that registration board is only a small part of what it is that ARONAH does and is doing. So lobbying is part of it. So actively engaging with state ministers as often as we can, and in whatever channels we have available to us, to try and push forward for statutory registration. But we're also developing degree accreditation standards and working with other accreditation and registration bodies internationally to support the transportability of practitioners, people who train in Australia being able to practice elsewhere, people practicing elsewhere being able to come to Australia. We've also working on a Trans-Tasman agreement at the moment with the New Zealand colleges and associations to really shore that particular pathway up, because we've got such close ties with New Zealand, and also working with the colleges to try and develop a group or a collaboration amongst the colleges so that they're working more cohesively together to strengthen the education of naturopaths in Australia.
Amy, one of the arguments I've heard is that if we go for registration, we'll have to give up so much, and furthermore, we'll have to do further study and we won't be appreciated for our prior expertise. Now, in my mind, this sort of thing is a parallel to what happened with nurses who went through the hospital system, having to upgrade to a degree external to the hospital system. It was just something that was a natural evolution, and they were given a certain period of time, and it seemed to go hand in hand. Tell me what that fear is, and what do you think the reality will be?
Well, the reality is that the way it works in any profession, and as nurses, midwives, TCM practitioners, this has all happened for all of these guys, is that when registration comes in, they have a grandpa parenting period in which they acknowledge that practitioners have trained when there's been different levels of qualifications available. And no one would ever suggest in nursing or midwifery that a practitioner who has been in practice for 40 years and trained in the hospital system and has a certificate is less capable or competent as a practitioner than those who are just graduated with a degree. That would be a completely inappropriate thing to say. And so the registration boards acknowledge this. I mean, registration boards are made up 80% by practitioners, so they know their profession. And so the registration boards acknowledge this, and they set up grandparenting standards in which there are just pathways in for people with different levels of qualification. And all they need to show, people with degree training can show evidence of their degree, but people with other levels of training, and particularly certificate or diploma qualified practitioners have been around for 10 years or more and have been in practice, or 20, 30, 40 years. A lot of these practitioners have been around for a long time. As long as they can show that they've been in practice and maintained the recency of practice and continually attended CPD training and education opportunities and have kept themselves up to date, then they are grandparented in and they are kept within that system. There's not even an expectation that these practitioners upgrade their qualifications so long as they show that they've maintained recency of practice and they haven't been out of it so long that they've forgotten or they've missed new developments that are actually really important to providing safe and effective care in modern times.
So it's really got to do with safety and currency.
Absolutely. And so, in fact, the purpose of registration is not to place value judgments on currently trained practitioners' qualifications at all. It's actually to be as inclusive as possible. And the purpose of registration is to say, identify a profession that needs to be registered and figure out a way of capturing all of those people who rightly and justifiably fit within that profession, and then providing structure upon which to ensure that they are accountable for their practice. So it's not about trying to exclude practitioners who should be included, because by doing so, those practitioners aren't stopped from practicing at all. In fact, they're continuing to practice under the regulator's eye. And so that's not what they want. They're trying to capture as many people as possible so that they're part of that group that are held accountable for what they do.
Yeah. So do you think there would be any drawbacks to statutory registration for the profession?
Look, the main thing that I would say is really there's an additional cost attached to it. And I mean, practitioners will complain about ARONAH's registration.
We all do.
Which is $150. But I tell you what, it does add more cost. Absolutely it does. It is a user-pay system in the sense that the government doesn't fund really statutory registration, the profession does. And so the viability of statutory registration boards and what they do is funded by the members of the profession. And, they could be up to $800 a year. That's kind of what I think is averaging out for a lot of people. So I think that would be the main drawback. The rest of it is defined by the profession. What we're trained in is defined by the profession. And so what our scope of practice is defined by the profession. And the board is made up of the profession. And so people who are found to be practicing outside of registration standards are being assessed based on the standards that have been developed by the profession. It's all about the profession, really. And the main drawback is that there is an extra cost attached to it, but it's a trade-off for ensuring public safety.
And along that line, I think one of the things that I hear in the nursing or in the APRA circles, if you like, is those instances where practitioners are sanctioned. So, for instance, unless it's a public menace where that nurse, caused a fire which caused the death of, I can't remember how many people, disgusting behaviour. But there are many cases where, I'm going to say nurses because I know about it, where nurses are sanctioned because of unsafe care or because of more precisely unsafe conduct. Or practice, and it may not be affecting somebody else. It may be things like addiction. They're using drugs of addiction or stealing drugs of addiction, and so they're sanctioned. But that doesn't necessarily make them media. And so this is one of my arguments for registration is that, and I'm not saying it's a closed book, I'm just saying the things that aren't necessarily appropriate to be publicised in the media, because it really doesn't matter. It's something that's against that practitioner for unsafe conduct. The regulatory body can then take sanctions and not worry about backlash for the profession.
Absolutely. And look, I think, the things that really kind of escalate, even if there were issues people who've been picked up for doing the wrong thing, who are under the label of being a naturopath. One of the things that we talk about with registration as well is that it's proactive and not reactive. So and there's a starting point, you're screening practitioners as they're coming in to ensure that they have the appropriate trainings in ethical conduct and clinical care and those kinds of things to know. So they are aware of their boundaries and they're not making silly mistakes that are inappropriate, but just through not knowing any better. And so you've got that screening process, but you also have this infringement approach that you're kind of working towards, where you can pick up minor indiscretions along the way, minor transgressions, I should say, along the way. where people maybe have done something that they shouldn't have done. It's not caused anyone's death or even major harm, but it has been identified maybe by another practitioner as, hang on, you shouldn't be doing that. Mm-hmm. That's not okay. And so there's a disciplinary response rather than a penalising response. And so the response is, okay, there's obviously a gap here in what you understand is okay or not okay in terms of ethical conduct or clinical care or whatever it may be. So we've identified that. We're going to put you under a limited registration banner, make sure you're working with someone who can oversee that whilst you upskill in that particular area, and we're confident that you're going to be able to move forward again and practice safely and appropriately. And so these minor transgressions wouldn't make the media. They're not particularly interesting. They're not sensational enough. But what you're doing in doing so is providing support to the profession in a way that doesn't completely disregard practitioners who have the capacity to provide good care but might have just been missing a few points along the way that they needed to brush up on.
Yeah, and indeed, conversely, I think protecting the profession.
Absolutely. And, the rates of complaints, I mean, we get a lot of complaints coming into ARONAH about practitioners, but the thing is, at the moment, we don't have anywhere for those complaints to go. Yeah. And the HCCC, the Health Complaints Consumer Commission, will only act on the more serious ones. And so the minor transgressions kind of get missed, which gives the opportunity, not opportunity is the wrong word, but creates a situation where practitioners who are undertaking these minor transgressions may extend those without realising that they're causing a problem until it becomes a major problem, then it hits a headline. It ruins a practitioner's career and it affects someone's health or in an inappropriate way. And there's this terrible tragedy that arises that there was potentially opportunities before then to address and provide support to the practitioner and keep them well trained in the profession.
Yeah. So, to all intents and purposes, registration is really the safety net for the profession.
Oh, I believe so wholeheartedly.
Yeah.
ARONAH is a volunteer-run board. There's no one on the board who gets anything out of it except for the opportunity to spend their own time doing something that they get nothing back for, other than seeing the advancement and the stabilisation and the future of the profession being maintained. So it's from that point of view, I wouldn't be doing what I'm doing if I didn't feel wholeheartedly that it was a thing that needed to be done for my profession to be able to exist and grow and develop into all of it, the fullness of its potential into the future. Otherwise, I wouldn't waste my time away from my family and other things.
I hear you there. One of the questions that I get asked sometimes is, how is a lobbying group different from a registration? So I'll frame this up. How is ARONAH different from statutory registration?
Well, the main thing with us is that, as I said before, we're independent and voluntary. We also have a group of a extra set of activities that we're undertaking that are slightly more than what the registration board would undertake. And one of those is lobbying. That's not something that a registration board does at all. And often they will outsource things like degree accreditation. They will manage it, but they'll have another board or a body that kind of puts it together, and then they kind of support whatever that other body does. And so from that point of view, there's certain things that we're doing. But having said that, what we've done with ARONAH is actually, whilst we're not held to health practitioner registration, we've written it into our constitution that we follow the health practitioner registration legislation as if we were bound to it. And so we actually are really carefully making decisions. The decisions that we make, the guidelines that we write, the processes that we follow mirror everything that they do in APRA as the way that we can most closely align with that. And also in the hope that when statutory registration picks up, it's going to be a very seamless transition for the government. All the guidelines and policies and processes will already be established. They'll just be able to pick them up and run with them.
Okay, so what can current practitioners, real practitioners, do to support registration at the grassroots level, though?
Well, the main thing really is to advocate for and support registration in every opportunity that they come across. Write a letter to the State Health Minister. If you want some help with that, contact ARONAH. Support ARONAH as much as you feel you can. Of course, we're encouraging practitioners to join ARONAH, and part of the reason for that is because one of the criteria that the government looks at for whether or not a practitioner should be a profession should be registered is it possible? And so and is it practical?
Yeah.
And so by setting up ARONAH, we're kind of trying to show that it is possible, it is practical, it can work.
Yeah.
And so supporting ARONAH definitely is a great opportunity. We're actually setting up another option, which is kind of a Friends of ARONAH situation where people who may not want to join the register might still want to be affiliated in some way. So we're setting that up as well. But if there's anything even outside of that, we're happy to support people who aren't members of ARONAH, but if they want to get behind advocating for statutory registration. So if you want to write a letter to a State Health Minister, you've got an opportunity to meet with someone, get in contact with us. We'll give you some reports you can take with you. We'll help you draft a letter that you can send through. We'll work with you in whatever way we can, because at the moment, it is all volunteer, and every extra set of hands will always help.
Amie, I wholeheartedly support what ARONAH and indeed yourself are doing for the profession of naturopathy, because it's a really important leap, and not a step, a leap that the naturopathic profession has to take to protect both itself and the community in general. So I really thank you for your hard work done to date. Indeed, your colleagues, John Wardle as well, and others. So I really thank you for what you're doing for other naturopaths around Australia. Well done.
Thank you.
Amie, forgive me, one more question. Some practitioners around Australia feel that there's no reason to become registered because there is no harm from practitioners. So can you comment about this? Because to me there's been a bit of an argument and I don't think it's been answered properly.
Absolutely. Look, really, the harm from I fully agree that the risk to the public from having appropriately qualified practitioners providing care to the public is minimal. However, no one could possibly say that if you're saying your health treatment options are effective, they also, as a result, have harm. I mean, people can overdose on Picoriza, they can overdose on vitamin A, they can, provide the dietary recommendations that are unsafe. If people have got kidney problems and they're put on high-protein diets, there are risks associated with providing inappropriate advice and prescriptions. That's not to say that it's inherent that there is risk associated with appropriate advice and prescription, however. And so this is exactly why registration is needed. The people who are often arguing that there is no risk are forgetting that that's the same reason they also want practitioner-only products only available to practitioners, because there's a perception of the quality and the strength of the product, and that shouldn't be something people should buy off the supermarket shelf. If that's something if there is no risk attached to our products, then why do they need to come to a naturopath at all?
Yes.
So that's what it's about. And I think it's just a slight misinterpretation, and practitioners forget. I think they're scared or they're fearful that having a statement of risk will actually undermine the external perception of the profession.
And I don't think
that's not the case.
No, I don't think that's the case at all. Look at what's happened with an invasive therapy like acupuncture. They're afforded greater protection by being registered.
That's right, absolutely. And really, when it comes down to it, as I said, if our treatments do not contribute some risk if used inappropriately, then we have to question whether or not there's any effectiveness to them at all. And even without the treatments aside, there are other risks that we call indirect risks in the public health world associated with poor practice. And that would be misdiagnosis or late referral or not supporting other treatment options that the patient is currently using, for example. Yeah. So there are things that, again, come down to the practitioner being appropriately trained in what the capacity is for their therapies to provide certain outcomes, but also what they're not really going to get outcomes from. The point where you say, you know what, you're better off going to a chiropractor for your back pain, because if you keep coming to me, I can help you with your anti-inflammatories, but I don't know how to do manipulative therapy, so you're better off going to them. So, or whether or not it's a case of, you know what, it actually, you've lost a lot of weight and you're eating and you're not feeling well, and thinking to myself, there's potential other major serious conditions here. I need to refer you on to another GP or someone who can check that out. So there's direct risks associated with inappropriate use of the medicines, and then there's indirect risks associated with inappropriate referral practice and application of care.
Dr Amie Steel, I thank you for taking us through these such important aspects of hopefully registering naturopathy in Australia and being able to enjoy the protection to both industry and public that indeed some states in the USA, for instance, have. So I really thank you for taking us through that, and also for dispelling some of the myths that seem to be propagated around, certain social media circles. So well done for that.
Thank you very much, Andrew. I appreciate the time and the support of so many of the profession over all the work that we've been doing at ARONAH.
This is FX Medicine, and I'm Andrew Whitfield Cook.